everybody, it's Dr. Jen, and today I'm going to talk to you about overbite. Let's talk about what overbite is. People use the word overbite a lot when they come to see us, and the word in orthodontics is actually a little bit different. So overbite to most people means that top teeth are too far out in front of bottom teeth. That can mean that your lower jaw looks small or your chin looks like it's back a little bit, or it could look like your top teeth are just too far forward. The reason people talk to us about it all the time is because it's super common. It's one of the most common bite problems we see, and so we're fixing that every single day. Now, there are lots and lots of different ways that an overbite can be fixed, and how we fix it actually depends on how old you are, because we need to know if you are growing or not to determine the best way to fix that bite. Now, growing teenagers would be the easiest group to fix this type of bite in, so we're going to focus on them today, but adults can have this type of bite fixed as well. We use elastics to fix this type of bite, we use Invisalign, we use wings, we use springs. There's all sorts of funny things. We can take teeth out to fix this type of bite. We can do jaw surgery to fix this type of bite. It just depends on what your ultimate goal is and how old you are. So you just have to go see an orthodontist like myself if you would like to know how your overbite can be fixed. Now, if you've met me before or seen any of my videos, you probably know that I love Invisalign. It's one of my favorite products, especially for those teenage patients, because it's easy to keep your teeth clean in Invisalign and you can still eat whatever you want. And as you know, if you have a teenager or know a teenager, they're eating all the time. Now, the reason I like Invisalign so much for this overbite correction is that there are two different ways we can do it. So today I'm going to show you the newest, fanciest way that we have. It's called mandibular advancement, fancy word, with Invisalign, which basically in our office we just call wings. So your Invisalign aligners come with some extra special wings on them. Let me show you what that looks like. Here's our little model. Sorry for the squeakiness. Basically, I'm going to zoom in here a little bit. See how there's these little wings on here? Kind of see it from the front. Now these are near the back of the aligners, so your cheeks cover them, okay? Nobody can see them. This person has no face. Just makes it easy for me to show it off. And what's going to happen is when you have these wings on your aligners, when you close your mouth, you are forced to push your lower jaw forward to be able to close your mouth. So if you don't push your lower jaw forward and hold it there, you'd be walking around with your mouth wide open. Nobody would like that. So you have to close your mouth with your lower jaw forward. What that does is it encourages this lower jaw. So it has to be a growing lower jaw, but it encourages this lower jaw to go this way. Our face is naturally growing down and forward. When we use something like this called growth modification, it's just trying to get your lower jaw to grow forward as far as we can get it to go, okay? These awesome little wings, because they're attached to your Invisalign, are automatically in there all of the time. So just like with regular Invisalign, you just wear your aligners 22 hours a day. They come out to eat and brush only. And those wings are gonna hold that lower jaw forward so that it hopefully stays in that position. And that's how we close the overbite. Because you can see here, the lower came all the way forward to where the upper is, so it wouldn't look like your top teeth were too far out in front of your bottom teeth. So this is just one way that we can do it. You might have seen people with elastics that they take in and out of their mouth. That's another way to fix overbite. We use that a lot in growing kids or in adults as well. But this is kind of the newest, fanciest way that we do it right now in the office. It's great. Usually most overbites can be fixed in 2 years or less, especially if you're really good at following instructions. So if you're curious about getting your overbite fixed, you've thought about it, you should see an orthodontist. All the orthodontists will do this a little bit differently. Some people use wings just like we do. They might use other things. It's just based on how we were trained and what we're most comfy with. Just find someone that fits well with you. We're down in the south of Calgary, so pretty much anyone in the southeast or southwest, that's where most of our patients are. Some people from downtown come and see us. And so if you'd like our opinion, you can come visit us at the office and we'll tell you if we can fix your overbite and what your options are. You can actually also go to our website and we have something called a virtual consultation, which just means you send a few photos in and then we'll tell you exactly what we think you need, how long it'll take, how much it'll cost. You'll have all the details that you need. Both of those work fantastically well to gather some information. And then if you want to do it, we'll do it. So there are a lot of ways to fix overbites. We're gonna keep talking about those on these videos because overbites are what I'm asked about a ton. Probably that and crowding are the two most common subjects that we talk about. So if you're curious, you should see an orthodontist. We're a great place to come. I hope you have a wonderful day. I know it's snowy and gross out there. Build a snowman. It'll make you happy. I'll see you next time. Bye.